morning keynote, Andy Pumariega, is both. He is both an academic child and adolescent psychiatry leader and is himself an immigrant, and that experience informs his work. I'm not going to spend a lot of time doing the bios of folks because we want to keep to schedule and you have bios available to you. I will just say that we're profoundly lucky to have Andy here. He's professor and chair of the Department of Psychiatry at Cooper University Hospital and Cooper University School of Medicine at Rowan University. He has a long list of awards, publications, but is currently the president of the American Association of Social Psychiatry and the immediate past president of the American Orthopsychiatric Association, and has close to this. All of us will find this scary who are writers in this room. 400 scientific papers, chapters, abstracts, and monographs, and was the co-editor of the Clinical Assessment of Child and Adolescent Behavior. I could go on. I won't. Andy, why don't you now walk us through these issues as you see them, and we'll take it from there.
Okay. Well, good morning. And let's see if I can. Is this the button? Oh, well, I can just use the mouse. Ariel, the old-fashioned mouse. See? Yeah. Okay, it works. So I can use the old. All right. So.
Oh, there's also.
That's right. I can.
Keyboard.
Oh, okay. That's fine. Okay. So, want to thank the Dart Center, Scattergood Foundation, WHYY for the honor of inviting me here and having you share some of my work, a bit of my story, and some insights. To paraphrase Mr. Shapiro, I'm an immigrant kid, grown up. And as a result, I grew up asking a lot of questions. And that's essentially how I ended up where I am today. So I consider myself a 1.5. In the parlance, that means you were born in the home country, raised in part there, but then raised in part in the host country. I was born in Cuba, grew up in South Florida, which essentially still qualifies me as partially Cuban raised. But I came old enough that I remember the journey and also the impact on my family, my extended family, all the concomitant stressors. I married an Italian American who's very proud of it, but also she herself adapted to the Cuban influx in Miami and was bilingual and bicultural before I met her. It was incredible. However, after I graduated from medical school, I went north to see the world, i.e. see the rest of America. And that's where I really learned about the various issues that I'll talk about, the immigration story, and did some of my own research. So I'll share with you a composite of my own experience, other people's research, a bit of my own research, and also my clinical experience. So, obviously, you know this. The United States accepts the highest percentage of immigrants and refugees of any nation on earth. Altogether, over 40 million that currently live in this country, with 1.2 documented immigrants that enter annually. And they're pretty well spread throughout the country. As numbers that would surprise you, though, is a fair number of them in the south of the United States. However, what's really changed in the United States, and traditionally, as we know, the United States has been a nation of immigrants, but it was really changed since 1965, the Immigration and Naturalization Act, is the composition of our immigration. Before, it was primarily European immigration, whether it was Northern European, Southern European, Eastern European. After, it essentially mirrors the world more broadly and includes more people from what used to be known as the Third World, i.e. immigrants from Latin America, from Asia, from Africa. Still a number coming from Europe. Now, there are obviously pros and cons. I mean, some people talk about documented immigration as a brain drain for developed nations, and that's certainly one aspect of the story. And we have many professionals that come here. I myself even recruit some of them in my department who contribute to the health and welfare of the United States. We also, though, have the undocumented immigrant story. And that is still a significant one. Even though undocumented immigration has slowed down, that has been obviously a major source of entry-level labor in the United States for many years, and it's what has brought up a lot of the controversy that we see politically and policy-wise in this nation. And that immigration is largely from Mexico, Central America, but also from Asia and a bit from Europe. We don't talk about undocumented European immigrants, but they do come. We certainly hear a lot from politicians and policymakers about the resource impact of immigration. I love to cite the report that was put out a few years ago by the Texas State Controller. That's the person who actually has the state treasury and looks at the state economy. And the Texas State Controller did an analysis, a cost-benefit analysis. On the plus column, they looked at GDP contributed by immigrants and tax contributions. On the negative side, they looked at every cost: health, welfare, education, criminal, juvenile justice, you name it. The positive balance of the state of Texas alone annually was $25 billion. So I think a lot of these folks who dabble in politics and policy ultimately have to, if they believe in capitalism, they have to look at their own numbers. Sadly, they don't. They let ideology blind them to fact. And to some extent, this is also not new in America. Nativist movements are not unusual. If you're a student of American history, you certainly know that those have been around for decades and generations. However, the nature of immigration, the non-European immigration, fuels a lot of that sentiment. And I will add also another piece, which I didn't include here in my slide set, which is the new immigrants do not want to be melded into the melting pot. They want to retain their identities of origin. They want to be known, for the most part, as hyphenated people. And that's a big change, because when people came through Ellis Island and all the various ports of entry in the 1800s and early 1900s, they oftentimes we even had their names changed and became anglicized, and many times lost their identities. Now the new immigrant, and particularly even the younger immigrants, want to retain their identities of origin and want to have that bicultural identity. And I'll explain why in a little bit. I think that sometimes stirs up some of the conflict that we see today. Some of the previous, the European immigrants saying, well, how come these guys get to keep theirs and we didn't keep ours? So you might want to think about that. And obviously the impact of economic recession. When there's less to go around, there's usually more argument about what share of the pie. A growing population is that of immigrant children and children of immigrants. 2.2 million children in the United States are recent immigrants. By the year 2010, they comprise 22% of the school-age population, projected to rise to over 30%. However, 80% of children of immigrants are actually not children that came with their parents, like I did, but born in the United States. And they're American citizens. And that often gets lost in the debate, because they are Americans. They have their full rights as Americans. And they actually have a root in having at least a partial American identity. However, most live in a family where one or more of their parents are non-citizens. This is actually the fastest growing segment of the U.S. youth population. That is what's going to contribute to plurality in the United States actually being reached not by 2030, as was the original projection, but by 2050 was the original projection of the general population. 2030 is the new projection for the general population. For youth under 18, it is 2019. It's only 5 years away. So this gives you a picture of the distribution of our immigrant population. But we like to many times think these are only American issues. Well, guess what? In traveling to Spain to participate in an immigration mental health conference, I came across this data. The Spaniards are dealing with a lot of immigration. And look at that 31% blue group. Latinos from Latin America, a third of their immigrants just about, along with Eastern Europeans, Maghrebis, which are the Northern African population, the Sub-Saharans, you can see that, and also Asians. There's definitely a cost-benefit of immigration when you look at the broad scheme. To the host culture, obviously many contributions to culture, the economy, history, and overall advancement. To the individual and family, economic and educational advancement, political and social freedom. Many people come seeking that in the United States, and just overall greater opportunity than they would have had in their nations because of either their social structures or their economies. However, there are risks and costs. For the host nation, there are strains, social and educational, economic dislocations sometimes to the previous populations, and cultural conflict. And we have to acknowledge in America there is cultural conflict. Perhaps not to the extent of France, but some. To the individual and family, there is a cost as well, and that's the area that I have focused on. The loss of extended family support, loss of familiar values and language, emotional and psychological stressors, new economic stressors. Because even though people many times immigrate for economic reasons, what they don't realize is how taxing sometimes the consumer economy is. I.e., your kids are asking you for things you didn't think they were going to ask you for, like $100 sneakers. And potential exposure to multiple stresses and traumas. And for youth, there are pluses and minuses. So overall, better physical health, younger cohorts, higher numbers advancing to higher education, increasing participation in the U.S. economy, but also challenges that point to higher levels of stress and conflict in their families, disparities in economics, education, health, and mental health compared to other American youth, and increasing risks for mental health problems, as I will show you in a minute. And also including in comparison to youth from their nations of origin. So they have higher mental health risks here than they would have had in their nations of origin. So it starts with the immigration process itself. And obviously, immigration usually is propelled by some form of trauma or stressor, whether it is war, natural disasters, famine, difficult economic, political situations, etc. Then you have the potential trauma of the migration journey. The physical journey itself, dangers, victimizations along the way, loss of extended family supports. A colleague of mine, Eugenio Roth, has actually focused on studying many of the Cuban boat people. He actually did work in the Guantanamo camps back in the late 90s. He also is focused on studying Haitian boat people and their difficult journeys, and then their settlement in South Florida. And those journeys themselves, very high percentages of the people who make those journeys end up suffering from symptoms either of acute stress disorder, PTSD, or many other psychiatric, psychological problems. Post-immigration, you don't necessarily land in a nice, safe neighborhood with a white picket fence. You land in poor neighborhoods. You engage sometimes in multiple moves, seeking a better job, a better school. So that involves multiple dislocations. You many times have long-term separations from family. And that means either not seeing them for years or not seeing them ever. For my mother, it was never seeing her mother again. That was the major stressor. Economic and legal difficulties, even for those who immigrate legally. For undocumented families, we know that those are their added stressors, heightened stress and even risk of traumatic experiences at the hands of immigration authorities, workplace, school raids, and home raids, long-term detention, as we were talking, one of the participants here were talking about the correctional industry. There's a subsegment of the correctional industry is the immigration correctional industry. Some of it resides here in Pennsylvania, and sometimes they even detain whole families and deny them mental health services. This is our government taxes at work, sadly. And long-term stressors, discrimination, margination, domestic violence, community violence, economic stressors. We joined then the rest of the stressors of other minority communities. And obviously the multi-generational impact of immigration trauma. There's obviously some of the original work in this area has been related to work on the Holocaust, but then more and more there's work on other immigrants who have suffered trauma along the way, either in their nations of origin or through their journey or subsequently, and how the parents' adaptation to that trauma or lack of it, actually has impact on the next generation or sometimes even the generation after that. There are added risk factors for refugee children and their families. Obviously, all that I mentioned before, but definitely the experiences in refugee camps. Sometimes some of the worst trauma is perpetrated in refugee camps, conditions that are essentially lawless many times, and people are struggling for survival with each other, regardless of what international agencies say. I've dealt with many kids who actually have lived through those and have some of the worst PTSD that I've ever encountered as a clinician, and because of the degree of victimization. And these are people, because of the experiences that they suffered in their countries, the journey, the camps, who have very high rates of PTSD and acute stress disorder. They also have more sudden and unpredictable separations from their families and other supports. That in itself is significantly traumatic. And uncertainty about the permanency of their residence and will they ever return, and sometimes the promise of returning, not returning, that uncertainty creates its own stressors, along with uncertain legal status, again, and sometimes being a bit at the whim of the political circumstances in their home nations. The exile mentality sometimes can make rootedness and adaptation very difficult. And a footnote to that, if you want to see exile mentality going at a heightened pace, you can look at South Florida. And again, I speak of my own. People that worked in child mental health and developmental mental health had known that psychological identity is a very important aspect of mental health and adaptation, and that within that, ethnic and racial identity is a very important aspect of psychological identity. Erik Erikson, who's one of the early theorists in psychosocial development, really posited that. He actually learned that in American Indian reservations after he came over from Europe, interestingly enough. And he actually posited two concepts. One, that identity gets formed both by mirroring from your family, but also mirroring from your peers, and then internalizing those experiences, and then sometimes having to navigate the two worlds, the world of the home, the more traditional culture, and the world of the host culture outside the home, and the peer culture. We also have a lot of pressures, obviously, in today's world to assimilate and acculturate from the broader media. And I'm not saying necessarily you guys, I'm also talking about the commercial media. Madison Avenue is part of selling the American consumer product. The optimal adaptation for immigrants, and now a number of researchers have weighed in on this, is to develop what would be termed a bicultural identity, i.e. to have a rootedness in your culture of origin, but to adopt important elements from the host culture and cultures around you that fit your personality, that fit your unique adaptational style. And that's indeed how we come up with hyphenated identities. And as I mentioned, this is what the immigrant today aspires to, wants to be able to achieve, to retain their values, belief systems, and also adapt to the broader host culture and select the best of both. Now, that can lead to important mental health challenges. Within the family, that sometimes leads to an intergenerational schism. Youth are able to adapt a lot faster. They have, they have plastic neural systems. Their brains are geared to learning. They quickly pick up new language, cultural norms, social cues, and have more cognitive flexibility. They, as a result, develop less traditional views about their families. Parents, though, have a greater difficulty adapting to the new language, the new values, and the new beliefs. They want to retain more of their own. In part is because of less than cognitive flexibility as adults, but B, also fear of loss, of losing what they had as their original identity. And sometimes that also gets played out with their kids. As I was told, don't become too American by my parents, okay? Who's still worried that I became too American. And I can tell you that has actually now been studied systematically. It has a name. It's called a culture of the family distancing. Originally, it was described by Hispanic researchers, Saposnik and Bortes and Rumbau. They noticed that when you have that intergenerational schism, more acculturated youth, less acculturated parents, you have higher risk of family conflict, higher risk of conduct disorder and substance abuse. More recently, it's been rediscovered by Asian American investigators, particularly Huang, found the same thing, except the risk leading to depression and suicidality. So that's an important mental health dynamic playing out in immigrant communities. A more basic one is one around family monitoring, i.e., as immigrants strive both to make it on a day-to-day basis and hopefully advance. Sometimes they do take up a lot of their time in the world of work, multiple jobs, demanding jobs, and as a result, sometimes not as available to their kids as perhaps they could be or would need to be, and that reduces what is called parental monitoring, and that can obviously increase risk for conduct disturbance. I mean, literally, it is a simple logistic thing. If you don't know where your kids are, is there what they're doing? Acculturation stress is the summative effect of all these different factors and more of them. The pressure to assimilate, to avoid discrimination and margination, conflict between achievement orientation versus family relations and loyalty, that plays out in many immigrant groups. I refer you to a wonderful movie called Real Women Have Curves. If any of you remember that movie, it was about a Latino family in Los Angeles, a mother who wanted to start her seamstress and clothing business. She wanted her daughter to work with her, inherit that from her. The girl had different aspirations. She wanted to go away to school, to college. And she did, with a lot of support from both her father and also a mentor. However, the end of the movie is very telling. She is in New York, got accepted at NYU, going to school, but looks very alone in Times Square, i.e. had to sacrifice some degree of the family relation. So that really plays out that conflict. The loss of natural protective beliefs and values. Some original cultures have taboos against certain behaviors, risky behaviors like substance use, like suicidality. You lose some of those values, you loosen some of those taboos, ergo you have an increase in those risks. Changing roles, gender roles in particular. With many traditional cultures, there are more restrictions on women. As women become exposed to host culture, they expect more freedom, they expect more independence, and sometimes that can play out in conflict in the family with more traditional husbands and create conflict in itself. And you even see changes in the expression of mental health disorders across generations as assimilation begins to have impact. I'll mention the impact of xenophobia, which is actually one of the, sadly, one of the increasing stressors that we're seeing. Not only the impact of immigration raids, but also anti-immigrant violence, a lot of it since 9/11. We've seen murders resulting from it. Right here in Pennsylvania, the murder of a Latino immigrant who had a relationship with a local young woman in Shenandoah. And this is a group of young guys who essentially took out their frustration and anger on this fellow. I refer you in the immigrant raids to the report by the Urban Institute, reports on the study of the psychological impact of immigrant raids on immigrant youth, titled Paying the Price. And even school bullying incidents that involve not necessarily immigrants of color, even white immigrants. Phoebe Prince, I put S and that's wrong, an Irish immigrant teen who was actually bullied verbally using sexually explicit derogatory terms because she was attractive and attracted other guys, and it mixed up her Irish origin into those terms, and she committed suicide. Now, when you look at overall at psychopathology, as we call it in psychiatry, or mental health disorders, the studies have generally shown that the first generation, the immigrant generation, has lower levels of mental health disturbances than the second generation. And interestingly enough, the summation tends to be that less acculturated people have better mental health profiles, medium acculturated have medium levels of mental health problems, and more acculturated have worse mental health problems. You can posit different hypotheses for that, and actually there's been a number of epidemiological studies that have shown that. Hypotheses perhaps that they have a self-selection in immigrants, that the hardy ones are the ones that come. Or that immigrants, in their striving to achieve and to survive day to day, put off dealing with mental health issues, take somewhat of a blinders-on approach. I would say that's a valid hypothesis. But also perhaps that Generation 2 immigrants are even more vulnerable, having to deal with their conflicts between the host culture and the culture of their families, and also, to some extent, an internalized ethnic self-hate because of the xenophobic issues. Now, to look at the impact of these stressors, I had a visiting professor actually this past week, Dr. William Carpenter, one of the major experts on schizophrenia in the world. And he had this slide, and I borrowed from him for his presentation. If you look at the epidemiological risk factors for schizophrenia, and these are odds ratios. These are the likelihood that you'll develop schizophrenia. Obviously, number one is having an affected mother. Another one is having an affected sib. Worse if you have an identical sib than an identical twin, than a fraternal, than just a regular sib. The third highest risk factor is being the offspring of an immigrant, 4.5 times the risk factor. The fifth largest risk factor is being an immigrant yourself. So we are dealing with significant stressors, and they actually have an impact on biological vulnerability to bring out very serious disease states, such as schizophrenia. So we're not just talking necessarily about depression, anxiety, post-traumatic stress disorder. We're talking about the level of stress that can increase this kind of vulnerability. And I won't, given the time, I'm not going to go through a number of different studies, but there are a number of sub-studies, and I'm happy to share the slide set with whoever that point to the impact of family adaptation, of acculturation and family adaptation, the impact of acculturation and psychopathology in adolescents, for example. And I'll show you this. I was involved in some studies along the U.S.-Mexico border. We looked at youngsters that were on the Mexican side of the border, on the American side of the border, who had mixed parentage in between, but also American parentage or Mexican parentage. All these are Mexican-American. And when you look at that degree of acculturation, the youngsters on the Mexican side with two Mexican-born parents had the lowest rates of suicidal ideation, around 10%. The youngsters, this is in the past week, the youngsters with who were American-born with American-born Hispanic parents had the highest at over 20%, around 22%. And the other conditions in between, having one Mexican-born parent on the US side, one American-born parent on the Mexican side. I would call that an acculturation gradient. And at the same time, we also have disparities in health and mental health utilization. Many of our immigrant populations, Latinos, Asians, Russians, Bosnians, Southeast immigrant, all tend to use mental health services less than our mainstream population. Have lower access because of insurance, financial, and logistical issues, but also some of the stigma inherent in many of the cultures of origin, and particularly in the traditional families, interfere with accessing those services. So as a result, what happens to many of our immigrant populations, it's beginning to be what has happened with African Americans. They end up in the child welfare system and in the juvenile justice system because of lack of access to these services. So the question is, how do we deal with this? What's going to be our societal response and our response to the mental health system? Well, there's a movement more towards culturally informed, evidence-based interventions. Remember I told you about acculturation, family distancing, the intergenerational issues? There's actually an evidence-based intervention that addresses that, particularly around substance abuse. It's called brief strategic family therapy. The same people who discovered the phenomenon actually developed a structured form of family therapy that actually has evidence and now has migrated across different populations. There have been other offshoots of that intervention. There's one school-based intervention that combines individual, group, and some family work called Cognitive Behavioral Therapy for Traumatic Stress by Shel Karaoka out of UCLA. That was actually piloted in the Los Angeles Independent School District, was very effective in dealing with immigrant trauma and also community trauma. It's now being replicated in other parts of the country. A number of culturally based interventions that used cultural themes like storytelling, magical realism, collective action planning. One intervention that actually for suicide Latinas uses telenovelas as a psychoeducational tool. And actually this was piloted in the emergency rooms. And you go in the emergency room with a young Latina having made a suicide attempt, they sit down with their family and when they watch a telenovela about a Latina who attempted suicide, her family conflicts, seeking mental health services, it serves as a validation and educational tool, and then the mental health intervention starts. And telenovelas are a daily staple in Latino families. Collaboration with traditional healers and use of traditional healing approaches. We have a number of cultural competence standards that have been developed that many of them apply to immigrant populations. I've listed here a number going all the way back to the Surgeon General Supplement on Mental Health, Culture, Race, and Ethnicity in 2002. I was involved in the CMHS standards for underserved, underrepresented populations, but more recently in the development of the practice parameters for culturally competent child and adolescent psychiatric practice of the American Academy of Child and Adolescent Psychiatry. In fact, it's not in final review. It is now published in the Journal of Child and Adolescent Psychiatry, the October issue. And it addresses basic issues that clinicians need to pay attention to. Evaluating barriers to service, evaluating children and families in the language that they are proficient in, and the impact of dual language competence. Awareness of the clinician to their own cultural bias. Sometimes your own cultural bias may interfere with effectively being able to engage and to evaluate what's going on with the youth or the family member. Awareness by the clinician of how culture influences developmental progression, idiomatic expression, presentation of different disorders. Evaluating the history of immigration-related trauma and community trauma, assessing the level of acculturation in the presence of acculturation stress and intergenerational acculturation family conflict, including family members. With immigrant communities, the family is central. It is still the central unit. And involving families in mental health services is key, and oriented services to families is key. Incorporating cultural values and beliefs in treatment interventions, providing the services in familiar settings, not taking them out to unfamiliar settings in different parts of the town, in residential programs, etc., but in their own communities. Teaching appropriate behavioral management skills. You'd be surprised how many immigrants don't even know some of the basic issues around, for example, corporal punishment in this country. Pharmacological interventions. Ethnic and racial differences do have impact on how people metabolize medications. That knowledge also needs to be incorporated in services. And using interventions with evidence. And we have an increasing level of evidence with diverse populations of different interventions, primarily psychological, a bit pharmacological. There are specialized school-based mental health programs for refugees. The Robert Wood Johnson Foundation essentially funded a number of pilots around the country with a lot of good lessons learned that focus on different populations, that combine individual, group therapy, family resource support, and with a focus on trauma. The Newcomer Programs that are supported by the U.S. State Department in refugee destination communities are also an important story, since these are programs that not only help with child adaptation, but also family adaptation in the context of the school. And that's another key concept. For immigrant families, the school is the golden place. In some ways, it's the golden door. They see that as key to their child's advancement. I'll put in my call for rational immigration policy and again, I agree with Mr. Shapiro. You can't talk about mental health without talking about policy or politics. And we have to also look at assimilation policies, i.e., that some policies still tend to wreak a bit of forced assimilation. And that's detrimental to mental health. And societal education. And this is where you all can play an important role in terms of actively preparing Americans, and I put 2050, it's actually 2030. And for kids, it's 2019. As well as anti-xenophobia campaigns. I can tell you that xenophobia, again, in terms of violence, is still a major issue. The American Psychiatric Association adopted a position statement against xenophobia. The American Association of Social Psychiatry adopted a statement against the violence being perpetrated against the Sikh community in particular, just because of the wearing of turbans. So these are issues that I think deserve attention and to be brought to the attention of our mainstream culture. Thank you.
Why don't you come up here?
Thanks.
Put on one of these little wireless mics, and we can continue the conversation with the room for a few minutes. I'm going to ask you one or two things, and then we'll just pass the mic around. As you were talking running through the issues, and then particularly at the end, when you started talking about cultural competency among clinicians, and then in programs, and then thinking about the role that journalists and media have in preparing the country to deal with these challenges and supporting communities. What do you think would constitute culturally competent reporting as folks are going into communities and beginning to try to wrestle with these issues? What do you think the essential skill set should be?
Okay. I would start out with a sense of humility, of not knowing, of needing to learn, and having whoever you're interviewing become the teacher and the guide. It's what we try to at least teach in mental health, seeing the culture and seeing the issues through their eyes and their interpretation, because ultimately it boils down to how the person experiences their culture, how the person experiences the stressors. So that's in beginning. Also, background work on that particular population. You have to be careful not to stereotype on it, to say that everybody is the same way, that all the literature relates and the books or articles relate, but it's good background information. It can then inform where you look, how you look. I think also it's important to have a perspective of how you translate that to the mainstream community. And maybe that's a perspective that I take a little bit, try to take a little bit myself as I guess, Generation 1.5s are technically the bridge people. Try to bridge between the culture of origin and the host culture. So to the extent that you can serve that role and be bridge people, I think that also is be very effective.
All right, questions from the room? And, I have a few other things I may ask, but somebody? Anyone? Yeah?
Actually, I'm interested in terms of most journalists, if anything, were bilingual. And you and I both know that Spanish is very culturally specific, depending on the country of origin.
That is right.
And there's a lot of working, I think, for mental health professionals, but certainly for journalists, that we miss, even if we're bilingual. So how do we address this?
I think first that awareness that just because you have a working knowledge of what I like to call universal Spanish, quote unquote, or whatever Spanish you learned along the way, that doesn't prepare you to deal with the idioms and the expressions. And I know for myself, I started out with Cuban Spanish, okay, but when I worked in Texas for 10 years. I had to learn Mexican origin Spanish or Tex-Mex Spanish, and even, for example, for some of the research tools that we used on research along the border, we actually used interpreters that interpreted it to the idiom of the Lower Rio Grande Valley. So you have to get down to a granular level when you're talking about idioms and expressions. And some of the expressions have nothing to do with the words used. Like, for example, I can use one in English, feeling blue. Now, we're talking about a color, right? Literally. But when a lot of Americans talk about, or English-speaking people talk about feeling blue, they're talking about depression, right? To a Latino, that's a color. It's like, what do you mean you're feeling a color? But some Latinos might say, siento angustia. I feel anguish, okay? And many other terms that they might use. So you have to become familiar with those. I think as much as possible, also use a cultural guide, someone who's from that community that can help with some of that terminology and never assume.
So even when you have linguistic competence, you still may need a fixer. You still may need a cultural guide
yeah.
as a mediator.
Absolutely.
Okay. Someone else? Yeah.
When we report about issues like PTSD in such communities, what do you think? Is it as a journalist, should I focus on numbers or the data, or how often I should go into the personal anecdotes and narratives, and how difficult is it to sort of get into that aspect of their life?
Okay. I think you need both. I think you need to contextualize the data. And you contextualize it through the stories. Now, obviously, there's a sensitivity issue in talking to somebody who is still in the throes of suffering some of the impact of the trauma, who it might even stir up flashbacks for them and intense anxiety, emotional distress. So you want to be very careful around that, and obviously get consent. Many people use avoidance to deal with PTSD. That's one of the mechanisms that goes to PTSD, just actual avoidance of memories and avoidance of talking about the topic. What I do clinically, sometimes as I go around it, I don't necessarily ask them, tell me the details of what happened. If I don't feel they're ready to do that, I ask them, how has that affected your life? Without necessarily telling me the nuts and bolts, because that might stir up traumatic memories again. But to the extent that you can find people who've actually have processed it and have enough perspective, have reconstructed their story, which is part of healing from trauma. You reconstruct your traumatic narrative. That if you can find people who are able to do that, I think those people are very helpful. They're helpful translators and educators of the experience.
You know, thinking about culture, something else occurred to me. When you were talking about the Phoebe Prince case, it was one that I had followed pretty closely. There was not only conventional bullying, but also some internet bullying and other things. And that made me think that the current generations of immigrant youth, as other youth, are citizens, not only dual citizens of or dual members of their culture of origin and the culture of, in this case, the US, but they're also citizens of planet internet and planet social media. How are social media and immigration and mental health issues playing together?
You know, they definitely are. Social media certainly becomes a platform for immigrant communities and populations to cluster and to connect and to provide each other mutual support. It sometimes can be a place where some, xenophobic sentiments and intergroups conflictual sentiments get played out. So, and bullying is one of those cases. I mean, and sometimes even incitement to irrational behavior or violence. But you can even see it in subtle ways. I mean, people making slurs or making untoward comments on social media. I mean, I am not on Facebook. I've made that personal choice. My wife is. And she oftentimes has to hide or befriend people who make incredible comments, ethnic slurs, and sometimes these are people I think also have some of that disinhibition that you get because of the electronic communication media. It's like too quick to go from brain to keyboard without passing through the frontal lobe filters and the additional filter of paper and pen. And in the old days, I used to tell you, if you have something nasty you want to say, write it down, put it in the drawer for 2 days, then take it out and see how it reads. Now, obviously, it's a lot faster. So even at that subtle basis, I think those are social media is another place where a lot of this plays out. I saw it like around some of the national policy and immigration policy issues, the election of Obama. I mean, you name it. Yeah. And by the way, I'm saying the election of Obama itself is an immigrant issue. We forget he's the son of an immigrant. And he downplays it, but because he knows that it's tricky territory, just like racist is tricky territory. But if you want to read one of the best writings about identity and dealing with ethnic and cultural identity, read Dreams of My Father. I think Obama has a future as a cultural researcher.
After he's done with the current job. Yeah. One or two more questions, just to stick with time.
You spoke about stress factors. One of the issues I found interviewing asylum seekers was the stress surrounded by having to repeatedly tell their story in a sort of interrogation kind of situation. And I was wondering how you think is the best way to deal with that as a journalist, approaching them to tell their story again. They're often very frustrated within this system where they've been, doubted and questioned, especially when their stories can be very traumatic and dealing with, people doubting the reality of their trauma. So how do we deal with that challenge?
Well, I think in a way, by the way you're asking your question, is part of the answer is implicit, okay? Validation. People who've been through trauma, one of the worst things you can do to them is to invalidate their experience. And unfortunately, sometimes even family members do that to them. I've had immigrant kids who've gone through trauma and their own parents invalidated their traumatic story because it happened to be that the parents left them behind and felt guilty about having done that, and they couldn't deal with the conflict themselves. So that happens obviously within families, and, and needless to say, the whole bureaucratic and legal processes can also invalidate. So I think expressing or providing them validation is an important piece, but also their readiness to tell the story. If it's too painful, I think we have to be respectful.
What's a little bit of validating language? What's an appropriate validating but not excessive or pandering kind of response?
Even in the question, you could say, so tell me how that experience, affected you and affected you emotionally, or how painful it was. I mean, that presumes you're not saying was it painful. You're saying tell me how it was, how it affected you, how it may have been painful or was painful. So that question sometimes. I mean, it may sound like a little bit of a leading, question, but it can be helpful. And or comments that that must have been difficult for you to go through, or that must be frustrating. When it's obviously you're reflecting back the emotion that they're sharing with you.
Thanks. Part of the upshot of what you've talked about here is that perhaps there's a growing need for mental health services for immigrants, and I wondered if you thought that there was a shortage of that, or what sort of is on the horizon in terms of what we might want to report on as well.
Absolutely, there's a shortage. And there's really very little, except for refugee resettlement, which is a very specialized area, and obviously it's a very super high need area. There is a dearth, and even in refugee resettlement, there is a shortage. A shortage not just in terms of numbers, but also expertise and sensitivity, and there have been a number of entities, everything from foundations, academic centers, that have tried to rise to the challenge and try to develop that expertise, and also use people from those communities to help inform the programs, which I think is again, that's great, because you're using the person's own experiences, the experiences of the community, then to help design programs. And that's, I think, another important principle of cultural competence. You want to have the community play a very strong role in program design and program orientation.
We could go on clearly for hours, but Andy has places to be. We have a program, so we'll stop it there. But you all will have Andy's email contacts, and though clearly don't try to reach him by Facebook.
Well, exactly. And this way you can distribute
so the conversation can continue that way. Part of our goal here is to build up everyone's source directory. Now you are in multiple people's phone books, so you're in trouble now.
Okay.
Thank you.
I'm happy to be here.
Very, very helpful.
Thank you.